Hello, I'm Grahame Goode. I am the Deputy Medical Director. It is the 1st of December 2021 with the COVID update here at Blackpool Teaching Hospitals. As I'm sure you're all aware, the COVID situation has worsened somewhat with the new Omicron variant. So the messages have changed, and I would guide you to the NHS website and the government website for the latest data. Certainly we should all be using masks in shops. It's still obviously mandatory in hospitals and also public transport where it now becomes the law. In terms of data in the hospital, we currently have 27 inpatients with COVID. That is COVID patients within 14 days of a positive test. We have 22 in our hospital bed base, 2 on critical care and 2 at Clifton. So the numbers are fairly settled, and certainly over this period of time we have seen a fall in general numbers. And I think the take-home message from me today is going to be about immunisation. Certainly patients that have been doubly vaccinated and more latterly have had 3 vaccines with the 3rd vaccine are much less likely to get particularly sick, much less likely to end up in hospital, and thankfully much less likely to die. So for people who haven't been vaccinated yet, it's particularly important, particularly with the uncertainty around this new variant. Obviously from a science point of view, the next few weeks are fairly critical to see whether the Omicron variant is still susceptible to the vaccine, and that data will be coming out. But at the moment, certainly I'm urging everybody to get vaccinated. The booster dose has been widened, as you've probably seen on the news recently. So anybody that has had their double vaccinations will be eligible for a booster vaccine now 3 months after the 2nd vaccine. In terms of the hospital is very pressured at the minute. Winter pressures start very early. Our emergency department is exceptionally pressured, so I'd urge everybody to look at alternative ways by seeing GP, ringing 111 and being guided by them rather than turning up to the emergency department, which is very pressured. In terms of visiting, the visiting rules are still the same, irrespective of what's happening out in the community. So you are only allowed 1 visitor per patient. The rules are slightly different for children, where you can have 2 parents or carer. It's worth checking before you set off, just to ensure that you are allowed to come into the hospital. Obviously we want to keep numbers to a minimum in particularly crowded wards, and obviously face masks are mandatory. Just to finish off from me, many thanks to patients for being very patient. As you know, we are into our what we call restoration phase, where we're trying to catch up with a lot of the operations that have been cancelled during the initial COVID phase. We are working exceptionally hard to ensure that you do get your test and do get your operation. Take care and stay safe. Make sure you wear face coverings when you need to wear them. Hand washing is still basic hygiene, and make sure that at home in closed environments you do allow some fresh air in from time to time. Take care, bye bye.